So this is a labor bed. Again, it has the same things as the stretcher did in the triage area or the recovery room. It has the bands. You have the monitors to put on for the baby, and then also this labor bed can actually come apart, and we can do different things with it as we're laboring. We also have our extra tools we might need for labor and delivery. So this is called an exercise ball or a birthing ball, whichever you prefer. You can sit on these in labor, and it helps relieve some of the pressure on your back. It also helps some of the pressure down low in your pelvis. So we could sit on that while you're on the monitor. And then also, if you're laying in bed, we could use the peanut ball. This we put between your legs. Instead of putting a pillow between your legs, we put this between your legs, and this will help open up your pelvis to allow that baby to come down and out a little bit more efficiently and better. We've been using this for a couple years, and it works spectacularly. This, the size of your peanut ball depends on how long your legs are. So there might be different colors that the nurses use depending on how long your legs are. But this is a wonderful thing if you're in bed, and we will try to use these because it works great. Otherwise, we also have our tools that we would use for labor to help massage. We have our bag of goodies. We have a whole bunch of stuff in there, but we have just things that don't use the vibration. We can use effleurage, and effleurage is just kind of putting it onto your skin. And what that does is it helps block the nerve sensations, and you don't feel as much discomfort. So we can use a lot of different tools. You can see how the little sticky things poke in there. And we would put that on your back, on your shoulders, wherever you had discomfort. And that worked nicely for a lot of people. And of course, you can also use the massage tools like this. And so we have all those available here. If you have anything from home that you would like to bring in, that's fine too. You can bring lotions. You can bring smelly things as long as they don't plug in. You can't have anything that you light on fire. Excuse me. You can have the things that plug in. You cannot have anything that lights on fire in the hospital. So if you want essential oils, it's okay as long as you have a battery-operated ionizer. The other things that we have in the labor room is the jacuzzi tub. The jacuzzi tub is in here for the mommies that are in labor. The sanitized papers just say that everything's nice and clean in here, but this little seat comes out, and you can sit in there, and the jacuzzi tubs will go, and you can be in the tub for up to an hour. We don't want to overheat you and the baby, and then you have to be out for at least an hour, and then you can go back in if you really love it, which most people do. And then we put this seat in here afterwards for when you deliver. You can sit down. You don't have to stand up to shower after you have your baby if you want to sit down, because you might be tired. Who knows? So this is the bathroom, and this is a one-person jacuzzi tub, so daddies do not have to bring their swimsuits with them. We also have a chair that comes into a bed for the dads or the significant others or the family members that are with you. And this chair just comes completely out into a flat bed. And that way you guys can, if mom is resting, you could be resting. And so we have that in all of our labor rooms. We also have the rocking chair. The sitting upright or forward leaning is your friend in labor. And so sitting in the rocking chair, or if you feel like that's not really comfortable, we can make this bed into like a throne position, and we can actually put the feet down, and it's really comfortable to be sitting in this position when you're in labor. And so the bed actually does some crazy things, so we can do whatever is most comfortable for you. So some people actually will lean right here and just lean over the bed like this, or they will sit on the bed with their butt here and put their feet down so they're in like the throne position. I call it the queen throne position because you are the queen until the baby comes. Also, this bed does come apart. This bottom part comes off in case when you're delivering, the doctor might want to be closer to your bottom, the exit or the vagina for delivery. We can actually take this bed off. And there's foot supports right here. So we have that also. And then every baby has their own crib. This is your baby's until they go home. And I got a little diaper out so you can see a little newborn diaper because they're so cute. And then your baby will also get a plain hat at delivery, just the pink and blue. And then we have people that have volunteers that have made some crocheted ones, and we'll get you a pretty one after the baby's head is a little more clean after delivery. So you can keep those if you have a dog. You would want to keep this and bring the smell home. If you need to bring a blanket home for the dog, you can do that too, or the cats. And then this is your crib for the whole time the baby's here. This is the delivery table. We only set that up when you're getting close to having the munchkin, and that's just some tools for the doctor in case they need everything. Here in labor and delivery, we'd rather be extra prepared than not prepared enough. So we'll open this up and kind of get it all sterilely set up for the doctor, and they rarely use much of it, but it's good for them to have, just in case they need anything. And then this is the baby warmer. So we use the baby warmer for resuscitating the baby, but we also use it when you guys are ready to weigh the baby, check their length and their head circumference, and we also can check their oxygen on here. So at some point after the baby's born, we'll leave the baby on this warmer that's still in your room for about 10 minutes so we can do a full head to toe assessment and do those measurements, because we can't do that on mama. But we do want mom to do skin to skin as much as possible after delivery, because that way you are initiating the bonding and the release of the Pitocin and helping your milk come in if you want to breastfeed. So skin to skin is super important, and so we do recommend doing as much skin to skin as possible for the first month of life minimum. And daddy can, or your significant other, can do skin to skin also whenever you're busy, like if you want to eat or something. Your significant other can do skin to skin also, and that's really good for your baby to get used to your smell and your bacteria, so you get used to that part of it. The other thing is, for first time moms, the average for labor is 16 hours, and that is once you start into labor, actually start changing your cervix. So if you're having some cramping and some contractions, you might not actually be classified as in labor until you have cervical change. So for a first-time mom that hasn't labored before, the average is 16 hours of actual labor. So that means you could be longer, it means you could be shorter, but the average is 16 hours. And then the other thing is, for pushing, the average is an hour and a half for a first-time mom. A lot of times it takes a little bit of time for you to figure out how to push and to push effectively, so that you could take 15-20 minutes just to figure that part of it out. So don't fret about how long it takes, but just know that it's normal to take longer than an hour, for especially a first-time mom. And we will help you the entire time. The labor and delivery nurses are wonderful. They're here for you, and they will help you with whatever you need, and support you with whatever choices that you want during your labor and delivery.